Hello, my name is Taya Gordon, and here is my Community Elder project. So a little introduction, the elder that I had chosen to do my project on, we'll call him S&M here. He's a 67-year-old man, and some of my feelings and expectations that I had going into this project. So overall, I had very positive expectations going into this project. He was super easy to talk to and get along with. I was slightly nervous going into this project, just not knowing exactly what to expect. The only issues I could ever see arising would be more around scheduling, particularly my schedule. Right now, unfortunately, my clinic is very short staffed, so I've been working overtime there. I also have a small self-run business that I do on the side, as well as being full-time status at school. So I was a little concerned that we would struggle getting our meetings in, but I was very grateful that SM was amazing working with my schedule so that we could get all of those meetings in. Very grateful for him. So patient-centered care, assessment tools. The assessment tools that were provided throughout this project were very helpful and helped create a clear picture on what was going on with him. They were also quite easy to use, as well as interpreting the results of these tools. Performing the assessments in his home versus a clinic or hospital setting, I believe made for a more comfortable environment, which helped build rapport and trust, resulting in more honest and accurate answers. Especially with SM, he states that he really hates going into clinics and hospitals. So having it at his home was a lot better. And for example, like he told me that he was a lot more comfortable completing the depression screening at home versus in hospital and clinics, which he has done a few times before. The standardized assessment tools are very important in nursing as it creates a baseline to which you are able to compare future assessments to, so you're able to clearly see if a patient is progressing or regressing. They provide consistency across all different healthcare settings, reducing variability in assessment practices, and by having these standardized criteria and guidelines, these tools help nurses accurately assess patients' conditions, leading to more precise diagnosis and treatment plans. Sorry. These tools facilitate efficiency and communication among healthcare providers, which support quality improvements in patient-centered inpatient care based off of evidence-based practices. Clinical judgment. SM, as many others, did not express joy when thinking about aging or talking about aging. There can be some negative effects. He did have a poor attitude towards aging, although he did rate himself as being better off than other people his age, which I would agree with that statement as well. I feel like he's put in good effort in trying to take care of his body, staying healthy and active as he's aged. Thankfully, he's been able to do everything, or the majority of things, without being held back by any health issues. The only issues that have ever arrived or like that have hindered him at times have been some pain in his joints, usually in his hips or in his feet. And even though he does have some pain at times, he tries not to let that get him down, and tries his best to stay active. And it's really awesome to see, like, in the short amount of time that we have been working together, I've seen some mobility improvements with the exercise goals that I've given him, and then also the range of motion exercises I feel like have been very helpful. So that's pretty cool to see. Strategies that nurses can take to help older adults adjust to changes in health associated with aging and mitigate the effects of complex health syndromes and illnesses. So education and empowerment. Providing education about normal aging processes and potential health changes empowers older adults to understand and anticipate age-related changes, so it can enable them to help better manage their health as they age. Holistic assessments, conducting comprehensive assessments that consider physical, psychological, social, and environmental factors, help nurses develop individualized care plans that are unique to that patient's needs. And then promoting healthy lifestyle choices and behaviors such as regular exercise, balanced nutrition, adequate sleep, stress management, that can help prevent chronic conditions and promote overall well-being. I feel like this is one that I had focused quite a bit when it came to my project with SM. Medication and pain management, assisting older adults in understanding their medication, including proper dosage, potential side effects, and interactions. That'll help with compliance of them taking their medications correctly and reduce adverse drug effects. Social support and connection. Creating opportunities for social interaction with peers, family, and community can help combat isolation and loneliness that older people can have as they age. Communication. So SM and I had no issues or challenges when it came to communicating. He was able to communicate everything that he needed very clearly. The only time he had struggles with communication was when we were talking about harder or sad topics, like the depression screening, as he was not as forthcoming or as eager to talk about those topics, which is understanding. They are hard topics. Communication is very different in a healthcare setting versus a community one like his home. The comfort of this setting allowed for easier communication, as well as not having and being in a hospital or clinic, there's not as much of a time restriction. So I felt like we could communicate more thoroughly without worrying of having to get to the next appointment or anything like that. We could take our time. And he did love telling me stories about when he was younger, stories about his time in the military, of memories of friends and family. And one thing that I really loved was he could even show me pictures that helped for deeper communication and understanding. Ways to enhance communication with older adults that facilitate engagement and is effective. So speak to them as a fellow adult. Having a physical, cognitive, or sensory impairment doesn't lessen their maturity. Avoid hurrying them and speak plainly. So using simple common language, try to avoid big, lengthy medical terminology, and always ask for clarification if needed. Address patients face-to-face or use visual aids. This is especially helpful with patients who have a hearing disability. So utilizing visual aids, writing it down, or printing out key takeaway points from appointments can help enhance retention and comprehension. Recognize that people from different backgrounds may have different expectations with communication. So providing translation services is needed is really helpful, as well as nonverbal communication. So pay attention to nonverbal cues such as facial expressions, body language, and then try to use those cues to convey empathy and understanding. Encouraging questions and allowing sufficient time so they can process the information and respond appropriately. Caring. The specific areas that SM needed to address to promote health and prevent illness included improving sleep quality and stress management, mental stimulation, good nutrition and staying hydrated, and then getting daily physical activity in. And when creating the health promotion plan that I used many evidence-based sources to address the areas listed. And then here's an example that I have on this slide that I gave to him. It's tips on how to stay active as an older adult, and then from the U.S. Department of Health and Human Services. So you can check out that link there. It has a lot of good information on it. Professional behavior. So advocating for older adults is very crucial. They often face unique challenges relating to ages, such as healthcare access or the limit thereof, social isolation, and ageism. Nurses can play a significant role as advocates for older adults by ensuring patient-centered care, so creating individualized care plans to help their needs, promoting health literacy, so educating older adults about their conditions, treatment options, and how to navigate the healthcare system effectively, addressing ageism, challenging those stereotypes and discrimination, and then facilitating communication, so helping serve as a bridge of communication to ensure understanding. Advocating for resources, so connecting older adults with resources and support that will help improve their quality of life, as well as ensuring safety and well-being. So for example, educating and advocating for safe environments and fall prevention measures. Empowering self-advocacy, so encouraging them to voice their needs and speak up when they need to. Policy advocacy. So engaging in policy efforts that make positive impacts on the health of older adults. And by filling these roles as advocates, us as nurses can help ensure that older adults receive the care, support, and resources they need to age with dignity and maintain optimal health and well-being. SM, he does have family that has advocated for his care in the past, as well as he does well for advocating for himself. He says that he does not have any issues speaking up in any kind of healthcare setting, which I think is great, and I encouraged him to continue that behavior and always voice his needs. And the summary and conclusion. So after this project, my views on aging have become more positive for these reasons here. So gaining wisdom and experience. Aging brings a wealth of wisdom and life experiences. Opportunities for growth. exploring new hobbies, engaging in lifelong learning, and pursuing personal goals without the pressures that come in earlier stages of life. So, for example, like the work and the school responsibilities. Being able to make a positive impact and contribute to society in many ways, like mentoring, volunteering, and sharing skills and knowledge with younger generations. And then making strong social connections that can last a whole lifetime. And I've learned many things from this project. Here are the 3 big takeaways that I will be using to help improve my nursing practice. So working on becoming a better advocate for older adults, researching and utilizing more resources for older adults, such as Meals on Wheels. Before this project, I didn't realize that there was actually a lot more resources out there than what I had known. So I would like to find more so I can help more older adults in my practice. And then continually improve my communication skills. So I believe this is one that I'll always be working on lifelong, but I do want to put a lot more effort into my communication skills, just to provide overall better care in my nursing practice. And then here are my references that I've used throughout the presentation, so you can check those out if you want. But that is everything. I hope you enjoyed my presentation on my elder community project, and thank you for watching.